Hello, my name is Dr. Dewan S. Raja. Today I will discuss about randomized control trials, RCTs. A randomized control trial is a type of scientific experiment often used in medical, psychological, and social research. It is considered the gold standard for evaluating the effectiveness of an intervention or treatment. This is the strongest epidemiological research design. It is stronger than cohort studies. It is stronger than case control studies. It is certainly stronger than case reports. In an randomized control trial, participants are randomly allocated into two or more groups. One group receives the intervention being tested, the treatment group, while the other group receives either a placebo or standard treatment, the control group. Randomization helps to ensure that any differences observed between the groups are due to the intervention itself rather than other factors. What are the features of randomized controlled trials? Random allocation. Participants are randomly assigned to treatment or control groups, reducing the risk of bias and ensuring that each group is comparable at the outset of the study. Control group. The control group provides a baseline against which the effects of the intervention can be compared. This group may receive a placebo or standard treatment, depending on the nature of the study. Blinding. Blinding involves withholding information about which participants are receiving the intervention and which are the control group. This helps to prevent bias in the assessment of outcome. Outcome measures. Randomized control trials typically measure specific outcome to evaluate the effectiveness of the intervention. These outcomes may include clinical endpoints such as changes in the symptoms or disease progression, as well as more subjective measures like quality of life or patient satisfaction. Statistical analysis. Data from randomized control trial are analyzed using statistical methods to determine whether any observed differences between the treatment and the control groups are statistically significant. So, what are the uses of randomized control trials? What are the applications of randomized control trials? There are many uses. Okay. Randomized control trials are employed across diverse fields, medicine and healthcare, assessing the efficacy and safety of medical intervention. RCT guide clinical practices and regulatory decisions. Public health intervention. Randomized control trials evaluate the effectiveness of public health initiatives, aiding policy development for disease prevention and health promotion. Psychology and psychiatry, determining effective treatment for mental health condition. RCTs inform therapeutic approaches. Education. RCTs assess teaching methods and educational technologies to enhance learning outcomes. Social policy, evaluating intervention for social issues. RCTs guide policy decision for poverty alleviation and community development. Agriculture and environment, informing sustainable practices. Randomized control trials aid in agriculture and environmental conservation efforts. Business and economic, assessing strategies for economic development. RCTs influence business decisions and policy formulation. Technology and innovation. Evaluating the impact of technological innovations, RCTs inform future development and implementations. Overall, RCTs, that is the randomized controlled trials, are pivotal for generating robust evidence, facilitating evidence-based decision making and policy development across a multitude of disciplines. So, what are the advantages of randomized controlled trials? Randomized controlled trials are widely regarded as the gold standard for assessing the effectiveness and intervention. They have multiple advantages: minimization of bias, random allocation of participants ensures that known and unknown variables are evenly distributed between treatment and control groups, including bias. Causality inference. RCT establishes causal relationship by randomly assigning participants to treatment group, allowing researchers to attribute observed differences to the intervention. Control condition. RCTs are conducted under controlled settings, standardizing intervention delivery and minimizing external influences for enhanced internal validity. Statistical power. Designed with statistical power in mind, randomized controlled trials can detect small differences between groups with confidence, ensuring sensitivity to meaningful intervention effects. Generalizability. Despite control setting, RCTs offer insight into real-world effectiveness by carefully selecting participants, criteria enhancing applicability to broader population. Ethical consideration. RCTs are ethically sound, offering equal chances of receiving the intervention and undergoing rigorous ethical review to minimize risk and maximize benefits. Regulatory acceptance. Regulatory agencies commonly require RCTs for approving new interventions. As well, conducted trials facilitate regulatory approval and market access. In summary, RCTs provide a reliable and robust method for evaluating intervention efficacy and safety across diverse research and clinical contexts. So, what are the disadvantages of randomized controlled trials? Randomized controlled trials serve as the gold standard for intervention evaluation, but are not without drawbacks. Cost and resource intensive. RCTs demand substantial financial resources, time and personnel for planning, execution, and analysis. Ethical concern. Ethical complexities arise when withholding treatment from control group, raising questions about potential harm and fairness. Limited external validity. Conducting RCTs under control condition may limit generalizability to real-world settings, affecting the applicability of findings. Practical constraint. RCTs face challenges like recruitment difficulties, high dropout rates, and intervention implementation issues, affecting study feasibility and reliability. Potential for biases. Despite randomization, biases like selection, performance, and detection biases can persist, impacting the validity of result. What are other disadvantages? Longitudinal limitations. Some interventions require long-term follow-up, posing challenges related to participant retention and logistical issues over extended study durations. Blinding ethical and practical consideration. Blinding may not always be feasible or ethical, particularly in studies involving visible or behavioral interventions. Publication bias. Positive results are most likely to be published, leading to an overestimation of intervention effectiveness and distorting the evidence base. Interpretation challenges. RCTs result can be challenging to interpret due to subgroup effects, adherence issue, and unintended consequences, potentially leading to incorrect clinical decisions. Despite these drawbacks, RCTs remain invaluable for intervention assessment, especially when complemented with other study designs for a comprehensive understanding of intervention, efficacy, and safety. And that's all about randomized controlled trial. What is it? What are the features of randomized controlled trial? What are the applications of randomized controlled trial? What are the advantages, disadvantages? So if you like this video, please share with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.